this is the next picture is the actual prior wound site that had been healed in this particular person that came to see me, where I gave the anesthetic. And this also has some funky stuff inside the jawbone, but I gave the anesthetic blockade. Within about 5 minutes, all the pain ablated. It just went away, whatever ill being he had. His heart normalized. It just went into complete normal. He felt great. And that lasted for about 36 hours. He had that one effect. And that's just simply a diagnostic test. It's not a treatment modality per se. And the tragedy is he's been to so many different dentists and physicians, and they say you're either crazy, it's in your head, and that's a completely normal looking site. Now, Christina, you've seen a lot of dental x-rays. Do you think that's a normal site, just looking at it? I mean,
No.
No, it's because you have a different set of eyes. But
Well, yeah, that's, you have to basically look and compare and draw conclusions.
yes.
Another thing is, you know, can you imagine on that side they do bone graft and they cover it up and what's brewing underneath? So that's scary.
Yes.
Bone grafts, implants, all those things, that's another biofilm. The biofilm is produced, you're not gonna grow trees on concrete, but depends on the soil. This soil attracts those bugs, this soil attracts those bugs. Same thing, gold attracts different entities, and other metals attract different entities, and there is a lot of aspergillus, I have to tell you.
So, yes, and we found the aspergillus on our the tests.
Lots of it.
So this is a big kind of a public health thing, and when the DNA Connections people have done the bone grafting that Christina's talking about, they've been able to culture out a lot of the same things that we're seeing here as a test, or during the testing process. Okay, then patient consented, then we did a full flap debridement of the jawbone, completed. It only took a little over an hour. And then he had now complete cessation of the pain problems that he had ongoingly. And this is now a bit over a year old. So he is one happy chappy. Some other inflammatory markers. There's that we talk about. I don't really look at these. My colleague in Germany is big on these markers, inflammatory. Rantis, IL-6, and the high sensitivity CRP, looking at those. And he'll take the cavitational lesion materials, instead of sending it for pathology analysis, he's sending it to a lab that they have special over there that can pick up these ranties they have. And so it's a very interesting thing. So we're looking at the same entities from a different perspective. Many years ago, probably 20 years ago, this fellow Neil Raskin was the head of neurology at a university in San Francisco, and I was at a headache conference at Camelback Inn, and he said that as far as he could see, he was a very early person as a physician thinking about cavitations. He would send anybody that had migraine headaches to an oral surgeon and have better, like a 90% cure rate, and people that had those kind of problems. So I just thought that was an interesting thing. He was quite a bit ahead of his time, and it just never caught on in a big way. I wanted to bring up, we're starting to wind down here. I wanted to just touch on some research. It's not my research, but from Dr. Nathan Bryan down at University of Houston, I think he's at, on nitric oxide research. You know, one of the things that is commonly used in dentistry and out in the world is chlorhexidine. Chlorhexidine is an antibacterial, and they found 1 week's treatment of chlorhexidine caused a 26 millimeter of mercury increase in systemic, your blood pressure, in other words. So just using that, because it kills the bacteria in the body, in the mouth, that are responsible for creating the nitric oxide, which modulates a lot of the heart activity. And so when you're killing it all up here to start with, it's, you know, the cascading effect that has been now identified is having these kind of consequences. So that is just a little thing about that, because, you know, we're wanting to kill the bacteria in the blood, and the chlorhexidine is a way to do it, and it's a trouble. So
Has there been any other work that relates the flora in the mouth with the flora in the gut and relative health diagnostically?
not from what I could see. You know, I just did this research over the last week, so I could see what's currently out there. And this is a few years old by their own admissions, but if they're estimating 750 to around 1,000 life forms, they've only identified 280 in the mouth. And there's, you know, this is a big job for that. So to try and get to any algorithms to say, if you have this mix, you're gonna have that disease, or you got this mix, you'll have that disease.
Wait a minute, I got a question.
Sure.
Didn't you just say that the chlorhexidine in a mouth for a week reduces the bacterial load, but the bacteria create nitrous oxide,
Nitric.
with nitric oxide, which has to do with blood vessel relaxation. So the outward effect is an increase in blood pressure, all of which leads to a conclusion for me that there definitely is a symbiotic relationship between what goes on in your mouth and the rest of the body.
Oh, yeah, yes, so I think her question was, as I understood it, how much of a study is out there that could say how many of these bacteria are shared?
Yeah.
And so they're starting, this research just came out last year from him. I met with him last year, and he said I can use all this material.
Well, we
and share
forget
this.
also about the DAM, which is hydrochloric acid in the stomach, that in that acidity not much survives. So you know, you may have lots here, but how many go down, it's related unless you are on protonics and all those drugs. You know, and on the long time, those people are sick forever and they never recover.
But that's the real question, though, whether in fact the hydrochloric acid dam works.
Well,
And whether there is somehow communication.
If there is hydrochloric acid, but if your pH is much higher than that, then you're out of luck.
Right, so I wanted to bring this as a point more of discussion rather than me being an expert. So this is an ongoing research project. Obviously, there's a lot that we don't know. There's a lot I'm concerned about, you know, these bacteria. I have you can ask for a handout of the bacteria that we've identified and kind of where they're from and what their effects are that are known in kind of simple terms, just one paragraph apiece. You could write an email to me and we'll send it to you.
I had a patient who was 92 years old. You know, lots of all different dental work in the mouth. I gave her no supplement, zero. Okay? This woman had 25 years of atrial fibrillation. Gone.
Yeah.
Within the same month.
Really?
She was in the hospital, in and out of the hospital, sick. The family was selling the assets. She was basically one leg with 24 hours aid, actually. That was gone. Was it after the first appointment, actually?
You took off all the supplements?
Excuse me, I gave her nothing, zero supplements. She was very concerned about the spending the money and everything else. She got nothing from me, just cleanup job.
So what did you
How
do
much
for her?
work has been done on the relationship between biofilm in the mouth and food, or food sensitivities, food allergies?
I have no idea.
You know?
I don't know. But that's my presentation for tonight, and I'm done. I'm gonna go off the clock here with Lisa here. So thank you for your attention tonight. This is a great opening though for conversation because it's really an important issue of all the stuff that we see, we're having to deal with. And, you know, we have there's a sicker, people here see sicker people than most people.
It's getting worse and worse, but
And
don't forget we are more inventive. Right now we have implants, which, talking about biofilm, well, big time. We have bone graft, we have all sorts of restoration that, before we never had existed. So, all different metals, galvanic reaction like there is no tomorrow, so we have everything. So,
What is the
Dr.
role of,
Meyer, thank you so much for the presentation.
that's really.
Thank you very much.
What's the role of this,
Much appreciated.
the